Good morning. Welcome to the Community Voice. I'm Steve Graddick, your host. Delighted to have you with us. Community Voice brought to you by Tanner Health System at Oak Mountain Academy. We're honored to have via phone this morning Dr. Laura Larson and Dr. James White. Good morning, doctors.
Good morning.
Good morning.
Good morning.
Dr. Larson is the Medical Director of Infection Prevention for Tanner Health System, board certified in both infectious diseases and internal medicine. She earned her medical degree from the Mercer University School of Medicine and completed her residency and fellowship at Shands Hospital at the University of Florida, American Board of Internal Medicine and Infectious Diseases, and also chairman of the Carroll County Board of Health. Dr. White, internal medicine hospitalist, graduated Medical College of Georgia in Augusta, and internship and residency both at Emory University in Atlanta. It's on the boards of the American Board of Internal Medicine and, of course, affiliated with Tanner, both in Carrollton and Villa Rica. Well, welcome again, and thank you for coming on. It's Dr. Larson. It's been a few weeks since we've been together on the show, so pleased to have you back. It's been a very long 2 months for everybody. Tell us where we are with this virus now and what we can expect locally.
So it's probably a good time to just kind of update on our numbers. We have 413 independent positive cases that have been tested in our hospital system. So when we look at our total number of tests, that's gone down below 13% of our number of tests administered. So we peaked at about 18% of our tests being positive a couple of weeks ago. So we have seen a steady decline. These next couple of weeks are really going to be something we're going to watch very carefully because we have obviously more of our state open back up. Obviously, we're concerned about those numbers going up.
Dr. White, most hospitals, as we didn't know 2 to 3 months ago, but apparently have not been overwhelmed, and apparently tell us about Tanner moving back to normalcy and normal occupancy.
Well, I've been really impressed by the community effort and the efforts made by the entire Tanner Health System at preparing for a surge that thankfully we never saw to the degree that we were concerned about. From the entire medical staff as a group effort led by Dr. Bonnie Bowles, Dr. Camp, and all the medical staff members, directors of prepared for that surge, and we were just very thankful that we never got to that particular point. We have seen, thankfully, a decline in the sickest of our patients, the patients that end up in the intensive care unit, patients that end up on ventilators. We peaked and now we have seen a reduction in those the patients that are the most ill. So we're very thankful for that. We feel like we have been very supported from all angles, including, I would say, from the community and the efforts that were made. So we are prepared. We certainly hope that this reopening or slow reopening of the economy and also the lowering of the restrictive covenants will not lead to an additional surge that would cause issues, but we're well prepared in that regard.
In the early days, there was a lot of concern about necessary supplies, both for the healthcare workers and ventilators. You mentioned ventilators. How did we do on the supply end of this in the last couple of months?
Yeah, Tanner actually did an amazing job. Just in general, we almost tripled the number of ventilators that we had prior to COVID-19. Concerted effort across the board, again, led by Amy Hunter, who was our lead respiratory therapist and director of respiratory therapy services. She and her team, supported by our intensivist team, did an outstanding job, not only making sure all the ventilators that we had previously prior to COVID-19 were maximizing their functionality, but also were able to find additional ventilators, ventilators that were in storage, ventilators that were refurbished, ventilators that are able to be conditioned to be utilized in the intensive care unit as necessary. So we tripled our capacity. We almost tripled our capacity in the number of appropriate ICU rooms that would be available for patients if necessary. We're just very thankful that we never had to utilize the majority of that capacity.
Dr. Larson, I interviewed Shane Bell, Operations Director at West Georgia Ambulance, a week or so ago, and he said people were fearful and have been fearful of going into the ERs. As we go back to normalcy, what kind of concerns would you say are reasonable, and how would you allay the fears of those who may need to go to the ER or be admitted back into the hospital?
I think that main thing is that we have a plan for triaging patients that may be COVID suspects versus not. So being able to triage those people that we think might have COVID and patients that do not is really important, and we have a safe plan for being able to separate those populations. We do that both in the ER and in the hospital proper. On our main floors, we have areas where we have known COVID patients together. We have a separate area for suspect COVID patients, and then we have areas where we have no suspicion of COVID patients. So keeping those populations separated is really, really important, and we're very attuned to that. My major concern is that a lot of people may be delaying health issues that would otherwise be very fatal for them as well. And we've seen that. In my non-COVID infectious diseases practice, I'm seeing people very sick with sepsis in the hospital that obviously have delayed their care of coming in. So I'm worried about non-COVID related mortality and morbidity too. So I think it's important for people to hear that we have a safe plan for separating populations at risk and to not delay care otherwise that would be something that could compromise your health in a significant way.
Our guests this morning are Dr. White and Dr. Larson with Tanner Health System. We're going to take a break, hear from our sponsors. If you have a question, you can post it to our Facebook page, News Talk 1330, and we'll be back with more after this.
As we journey through this global pandemic together, Oak Mountain Academy is lifting everyone in prayer and holding the community in our hearts. We continue to pray for all of the families directly impacted and the first responders and medical personnel on the front lines. There are so many individuals working around the clock to keep us safe and healthy. I'm Patrick Uran, headmaster, asking you to join all of us on the mountain in prayer and gratitude for everyone in our community. For more information about the Academy, visit us at oakmountain.us.
We know COVID-19 has made everything harder, including getting medical care. At Tanner, we've expanded your options to make sure you can get the medical care you trust. Tanner's Care Your Way gives you telemedicine visits for general and behavioral health, walk-in care at our urgent care clinics, and appointments at our emergency departments. Let's get better together with Tanner's Care Your Way. Visit tanner.org/careyourway to learn more. That's tanner.org/careyourway.
Good morning. Welcome back to the Community Voice. We have Dr. James White and Dr. Laura Larson on the phone. And being the really good radio broadcaster I am, I'm going to dovetail off that last commercial, tanner.org/careyourway. So basically, in that commercial, we're talking about we've got urgent care and we've got telemedicine. How do both those things integrate now in medical care, particularly locally?
Well, we're seeing, obviously, our outpatient practices are really utilizing telemedicine to make sure that patients receive access to care that they need, or preventatively and otherwise. I echo Dr. Larson's sentiments that our concern also is centered around those patients that have chronic non-COVID-19 conditions that are perhaps delaying their care either by not utilizing telemedicine services or by not necessarily accessing the emergency department in the early onset of their disease process, or if their symptoms are increasing. So we are starting to see patients with chronic diseases, as in heart disease and lung disease, come into the hospital more ill than they would traditionally be, because they are waiting till that particular point because they are fearing concerns of coronavirus. I agree that the efforts that have gone into appropriately triaging patients into either COVID suspected or COVID suspicious patients in one particular area, and then having our other patients that arrive for other concerns and conditions into other particular areas. There have been tremendous efforts gone into that, and I think they've been highly successful in regards of trying to make sure both patient populations, receive the care that they need.
And Steve, for my clinic, I'm still utilizing telemedicine, and we are planning to start utilizing in-person visits for those patients that do not have COVID symptoms. We are just cautiously and carefully reopening as well from a hospital system. We had a backlog of over 800 surgery cases that we're starting to work on now. We started those surgery cases yesterday. We are screening those patients ahead of time for COVID-19. Asymptomatic or not. We've been a little bit surprised that we've had some asymptomatic persons test positive, but that was not really completely unexpected. But we just want to make sure those patients are safe for surgery and that our healthcare staff operating on those patients are safe as well. So we're cautiously and carefully reopening across the board because you can't delay surgery forever in some of these patients that really need it as well.
Dr. Larson, let me ask you this question, and this has been in the news for the past week or so. The therapeutic drug Remdesivir has been approved by the FDA, from what I understand, for those who are hospitalized. What's your thinking on this new medication?
I think that there's some good data on it, that it's helpful to reducing the duration of disease. The problem, obviously, is for hospitals like ours, we can only get it for compassionate use in people that are pregnant and people under the age of 18. So even though it's been approved, it's a very limited drug that most hospitals can't get.
I understand it's kind of pricey, too. At least that's what I read. Dr. White, give us a little insight, if you will. We mentioned Remdesivir. How do you treat a COVID or a coronavirus patient? What's the first line of attack?
Well, and with this, unfortunately, with this disease as a virus, there is really only one course of treatment, and that is maximizing their supportive care. A lot of times that just centers around treatment of symptoms in regards to trying to reduce fever, making sure patients are well hydrated, trying to control discomfort, and primarily providing oxygen support for those patients that need it. Unfortunately, we don't really have any evidence-based practice of medications that are effective against it, hence the precautions that go into doing everything possible to prevent the spread. And then unfortunately, if someone contracts a disease, when they come to the hospital, we do everything we possibly can to support them through the process where their body's immune system begins to work against the virus. And thankfully, the vast majority of folks do recover. But that is what we have right now. And as Dr. Larson pointed out, even though there may be Remdesivir and some data that are encouraging, wouldn't want the community to get the idea that somehow now that we have truly known effective treatments that anyone could potentially have access to, or even our hospital, or even the teaching hospitals would have access to as a treatment mechanism for this particular virus, because other than supportive care, there's unfortunately nothing that has shown to be tremendously effective, although we're hopeful that we'll find more and more data and more therapeutics and medications that potentially could be effective in the future, but we're not there yet, hence the need to still be extremely cautious.
With that said, Dr. Larson, I guess the focus at some point shifts more and more toward the vaccine. We hear that the target date is the end of the year, hopefully, for a vaccine. What's your thinking on the vaccine issue, and what would you say to the public at large?
I think that there's tremendous work going on to fast-track a vaccine, and that obviously makes me cautious and concerned as well. I think that the fastest we've ever come up with a vaccine previously was 4 years. And so obviously this will have to be something that we have to produce that is both safe and effective. And I'm just watching that carefully. I'm encouraged that so many companies are trying to do this. But it's again, I think we just have to watch it cautiously, and it will have to be tested for safety as well.
From our Facebook page, we have a question from Karen Waldrop. She says she's curious if the doctors think the new antibody testing options in Carrollton and Bremen are valid, since not all tests are FDA approved.
That's really a very difficult question, because we know from our own testing with PCR that it's not perfect, and none of us know if any of these antibody tests are very sensitive and specific. There are quotes for numbers for each of those, but those are quotes early on and without a lot of validity yet. So the problem with the antibody testing is multifold. And number one, you can have a false positive antibody because you may have had a recent infection with coronavirus, and tests just cross-react. That's just a fact. We see that with other infections as well. Number two, what does a positive antibody mean? Does it mean you're immune? We don't know that. Does it mean that you can go out and be without protective equipment if you were at risk? We don't know that. So it's really, really difficult. I told the medical staff last week that it's really more of a curiosity, but it doesn't affect the way that I would practice. I haven't personally gotten an antibody yet because I don't know what I would do with it, and I wouldn't do anything different with it. I don't think it gives anyone an immunity passport. It's more of a curiosity right now. Until we really know what it means, I really don't think it affects the way that I practice my job. It doesn't affect the way that I would practice how I go out into the community and that type of thing as well.
That seems to me a little contrary to the news stories. I mean, my understanding was if you tested positive with an antibody, you were immune. So you're saying that's not the case.
We don't know what our level of immunity is. We don't know what titer is protective. So we just don't know yet. So for other diseases, we have a level of a titer that we know is protective. We don't know what level is protective for antibody testing because we haven't had the opportunity for people to get sick again and to be challenged with virus to see if they're truly immune. And coronaviruses are really difficult viruses in the fact that they previously have never really been ones that confer immunity. Infections with corona, we have 4 common coronaviruses, and people can get repeatedly sick with those. The other concern we have is that if a virus mutates in a community, mutates enough that it could also be potentially reinfective. We just don't know yet. We don't know what's protective yet.
Before we go to our next commercial break, let me step back just a moment, Dr. Larson, and just for clarity, did I misinterpret your comment regarding the vaccines, that it's going to take most likely a long time? And if so, could I interpret that correctly to say, as I think you mentioned, the safety of it? Do we need to be concerned about whatever vaccine comes on the horizon, if it comes quickly, as being safe or not? Yes,
we do need to be concerned. I do think I do think a vaccine is going to be available within the next 1 to 2 years. But again, I don't think that we will fast track something without having those safety studies done as well. And that's part of the development of a vaccine, is to vaccinate volunteers that are otherwise healthy and make sure that there are no untoward effects.
Our guests this morning are Dr. James White and Dr. Laura Larson from Tanner Health System. We'll be back with more after this word.
We know COVID-19 has made everything harder, including getting medical care. At Tanner, we've expanded your options to make sure you can get the medical care you trust. Tanner's Care Your Way gives you telemedicine visits for general and behavioral health, walk-in care at our urgent care clinics, and appointments at our emergency departments. Let's get better together with Tanner's Care Your Way. Visit tanner.org/careyourway to learn more. That's tanner.org/careyourway.
As we journey through this global pandemic together, Oak Mountain Academy is lifting everyone in prayer and holding the community in our hearts. We continue to pray for all of the families directly impacted and the first responders and medical personnel on the front lines. There are so many individuals working around the clock to keep us safe and healthy. I'm Patrick Uran, headmaster, asking you to join all of us on the mountain in prayer and gratitude for everyone in our community. For more information about the Academy, visit us at oakmountain.us.
Good morning. Welcome back to the Community Voice. I'm Steve Graddick, your host. We're honored to have via phone Dr. Laura Larson and Dr. James White. And you can post a question to our News Talk 1330 Facebook page if you like. We'll try to get it on. We're going to obviously run out of time. I'd like to take a little different tack just for a moment, if I might. Nationally, I understand that 25% of the deaths from the coronavirus were from nursing homes and assisted livings, and that's facilities across the nation, and that 80% were 65 years old and older, and that Carroll County has followed that national trend very, very closely. Am I accurate on that? And if so, I've got a follow-up question.
I would say those numbers are very accurate as far as Carroll County go. I'm speaking specifically for the two major hospitals, Tanner Villarica and Tanner Carrollton. Dr. Larson likely has some concrete data, but just from clinical practice and seeing the patients that we see, I think those numbers reflect our local population.
I can't imagine anything more horrible than to have an elderly loved one in the last days of life suffering under this virus, and yet you're not able to be with them, to talk to them, to see them, to be close to them. What have you, both of y'all being on the front lines of this, what have you witnessed up close and personal in the tragedies the families locally have suffered from this?
Well, you certainly see the difficulties in those situations, and it's heartbreaking when you have a patient that unfortunately is becoming more and more ill, and you realize that despite your best efforts, there's literally nothing medically that you're going to be able to do to change the course. I think the efforts that the medical staff has made, one major effort we've made, is to try to reach out to families as often as possible, realizing that they don't have access to being able to be there with their loved ones. So we try to make more phone calls. We definitely try to make the phone call updates if a patient, unfortunately, is showing signs of worsening, to do that very, very frequently to try to keep them as informed as possible. But I do believe that the challenge that we see in general from the separation, unfortunately, that has to occur in the hospital, it is probably the most emotional and most difficult thing that everyone in this pandemic has to face, both from families, patients, and in healthcare, is being part of that dynamic of separation. But we have made concerted efforts to improve communication, and most of that is by phone. We also allow compassionate visits for patients, unfortunately, that we do believe are getting ill to the point that we're concerned about their ability to pull through this particular type of illness. We do approve compassionate visits for those family members. And we also have a very supportive palliative care team, which helps for folks that need comfort care measures and need to have those ongoing discussions about when is that appropriate for the patient, when is that appropriate for the family, and when does everybody believe that is something that needs to be discussed as far as the care of the patients.
And we're also protecting those people that are coming in for compassionate visits with personal protective equipment to make sure they don't get infected as well. So it's a really well thought out and careful process.
Well, let's use that, Dr. Larson, kind of as a segue as we run out of time. In the current stage of this epidemic, Tell us your thinking again on those social distancing, washing hands, face masks, these measures. How do they relate to where we are now in fighting the coronavirus?
My biggest message for the community is that if you have a condition that will affect your ability to, if you were infected and it was a condition that would cause you to have a more risk of severe disease, like hypertension, like heart disease, like lung disease, like immune suppression, like obesity, like age over 60, I still think you need to be careful because we still don't know why some people just absolutely have a fulminant, horrible course of illness and why some people are spared. And until we know that, I think it's really important for you to be protected and for you to be more careful in the community. And if you cannot socially distance in places where other people are that may be asymptomatically shedding virus, you need to be careful and wear a mask and wash hands.
In speaking just generally, and I suppose in your career path, these kinds of practices have always been kind of top of the mind, whether we're talking about coronavirus or the flu, have they not?
They have, but we're just dealing with something that's very contagious compared with a lot of what else we see out there.
Before we completely run out of time, I think it would be remiss on my part. Tell us about, because it's not, just a couple of doctors. There's a whole team of people at all different levels that have responded to this. Tell us about some of your colleagues and some of the many staff people on the front lines there at Tanner and throughout all the healthcare practices, be it emergency ambulance services or assisted living, et cetera. What has it been like?
Well, there's so many. I would just call them Tanner heroes in this whole process, and it really starts with our board of directors, our Tanner board of directors, authorizing all of the necessary funding to provide what has to be done for the care of the patients in this pandemic. Mr. Howard, as our CEO, has done a fantastic job, and then Dr. Ben Camp is our chief medical officer, and Ms. Deborah Matthews as our chief nursing officer, and then Dr. Bonnie Bowles as our vice president, who has been taking the lead on coordinating the medical staff response. And this medical staff response has been across the board. Our medical executive counselor, Dr. Alicia Howard, who's an anesthesiologist, has been a fantastic leader in this process, pulling together every member of the medical staff to come together with a plan that provides for, or at least attempts to provide for, all the possible challenges that we will face. So all of those folks have been instrumental in pulling together, just to commend our medical staff, but our nursing staff and our respiratory therapy staff, they're the unsung heroes. They're the folks that are truly on the very, very front lines of this. They are wonderful, incredible, dedicated individuals. They've been under a tremendous amount of stress to see the illness and again, the family separation dynamic, which has been very challenging. But all of those folks are true heroes, and I couldn't say enough about the community spirit that has been behind this process to support our community hospitals, our community health system, and our entire medical, nursing, and support staff have been absolutely amazing.
And we salute all those healthcare workers. Unfortunately, we're out of time, and we salute Dr. James White and Dr. Laura Larson, and thank you for being with us. And please make it a great day. You're in tune to WLBB Carrollton.
National headlines and the local stories you care about.